My name is Bethany. I live here in Brookings. I run an in-home daycare. I like to go running. It's my, mommy's time alone. I like to bake. I like to knit. I like to watch movies. And our family is very musical, so we like to sing and dance and make a lot of noise around our house. I chose to breastfeed both my girls because it has so many health benefits. I really wanted to help protect them against colds or flus or, whatever I've gone through, whatever I've had. I'm going to help protect them a little bit more. I felt like it was a no question, like I'm going to breastfeed as long as I can. They were really encouraging immediately right away. They do the skin to skin, so we did that, and then immediately it took a little bit for Hannah to get ready to be able to eat, but Eden and Hannah both, they were like, do you want to try this position? Do you want to try this one? Do you need a pillow? Do you not want a pillow? Kind of trying to help me figure out what was the best position and how they were going to get the most food for themselves. And it was nice. The first time I felt like I didn't ask enough questions, so the second time I made sure I was asking as many questions as I possibly could. I started going because on one weekend I got a fever and my supply got cut down in about half, and that was super frustrating. It was like the hardest week of my life. Am I gonna be able to keep breastfeeding? It was so emotional. So I started talking to a lactation consultant. I got advice on when to pump, when to feed. It really helped, and my supply just like shot up after a couple weeks, and it was so encouraging to go meet with them, make sure she was getting enough, and just to hang out with other moms. That was really rewarding to hang out with other moms in that environment. With Eden, I only breastfed for 3.5, 4 months, and with Hannah, I breastfed for almost 7, so it helped me double the time. And like I said, the first time with Eden, I felt like I didn't use any resources. I felt like I didn't ask. I was almost afraid to ask questions about like what I can do to improve. Is this normal? Is this not normal? So the second time, it was really nice to be able to use these resources like Baby Cafe and get advice and have your baby, weighed before and after feeding to say, okay, she's getting this much. She's getting enough, or try this to get her to eat more, or, it was really nice to have that option, and just to get advice it was the biggest need I needed, and it was nice to be able to get that. I really appreciated the encouragement and the support. First time when I had Eden, not a lot of encouragement, not a lot of support. It was kind of awkward. People, say, breastfeeding, oh, that lady has a blanket out, or, oh, I can't, they make it awkward. And this time around, Brookings has changed to take a step forward to be more encouraging and to have things like Baby Cafe and say, hey, you can breastfeed in this room, this wide open room, and nobody cares that you're feeding your baby. And it's great. It was so encouraging, so uplifting, and to talk to other moms about, how is it going for you? How's it going for you? And how does your baby like it? And just kind of getting different tips even from other moms. So that was really nice. Use your resources. Don't be afraid to ask questions. I know it can be scary. You think, can they really help me? Take that step of faith and just, take a step out of your comfort box and say, this is happening. Can you help me? Then the biggest struggle I had during breastfeeding was thinking, can I still do this? My supply just went down. It was such a struggle because a lot of moms feel, I feel like a failure because I can't breastfeed right now. And I would say you're doing a great job. You're a great mom. Nothing is ever going to make you a failure because you can't do something. And maybe you can't do it as long as you want, but I would just say keep trying, ask help, ask questions. Don't be afraid. I tell all my friends, like, you should go to Brookings. They're really nice. I really liked my OB/GYN, my OB doctor. Really nice, really encouraging, and the staff at the hospitals they really go above and beyond. They treat you like a person. You're just not another patient to them. They really focus on you. And any problems that come up, like I said, they're ready to, they're hand in hand with you step by step. They're ready to take it on, whatever is going on with you. They're ready to jump up and say, we're ready, we're gonna help you.